Today we're going to be talking about injuries and recovery. But first I've got to read a brief disclaimer. Dr. Naomi Albertson is a physician at the Reno Orthopedic Clinic and the owner and developer of Dr. Nice OC2, a bone health and muscle strength supplement for adults age 35 and older who want to stay active. The information in this podcast is intended for your general information only and is not a substitute for medical advice, diagnosis, or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem or disease. Always seek advice from a healthcare provider with any questions or concerns you have regarding your health, and never disregard professional advice or delay seeking medical treatment because of something you hear on this podcast. Dr. Naomi Albertson and Dr. Nice make no representation and assume no responsibility for the information in this podcast, and such information is subject to change without notice. Hello and welcome to the Why Act Your Age podcast with Dr. Naomi Albertson. My name is Rob, and today we're going to talk with Dr. Albertson about injuries. And we're going to talk about, if you have experienced an injury, what are some tips to improve as quickly as possible to get yourself back to what you were doing before, whether that's a sport or it's just daily activities. So hello, Nye, how are you?
Hi, I'm great. Thanks.
Excellent. Let's start with, if you've suffered an injury, what should you expect? And I know that's kind of a little vague because the injuries could range from, you tore something in your shoulder to you've just got a small strain of something. But what's the process like when somebody comes into the office to see you?
Yeah, absolutely. So I'm a sports medicine physician. And so basically what my practice, looks like is I have a fair number of patients who are younger athletes, and maybe they're getting injured at school, on their school teams or in some sort of club team. And I see a lot of them after school, obviously. And then I have a fair number of patients in their middle age, right? Anywhere between 30 and I would say 60 who are active, and they're out there, and, maybe they have a traumatic injury, but maybe they just have something that's like, an overuse, like they just did too much too fast. And then I have a fair number of patients too who are, more elderly. So in their 70s, 80s, 90s, I even have a few in their hundreds who are still active. And, and in that age frame, really we're talking more about trying to control arthritic pain, trying not to be too much up on your joints, and again, maintain muscle strength and all of that stuff. So let me try to kind of give you a broad picture of what injury looks like. Injury, when we see injury in the office, it can be really traumatic. So, you slipped, you fell, you broke something, you slipped, you tripped, you sprained something like a ligament. Maybe you have a muscle injury, which we call a strain, or maybe, darn it, you just did too much too fast, and that happens to all of us, unfortunately, at one point or another, where we think like, oh, awesome, it snowed, like I'm going to go out and ski, and I didn't actually do any preconditioning. So now, I'm paying the price the next day, or maybe even the time because I get injured, because I didn't, prepare for it. So, I would say in general, Rob, like when I see people in the office for some of the lower level injuries, and I tend to call them, overuse injuries. So if you're a hiker, if you're a biker, if you're a skier, if you're, whatever your sport is, and you do lots of it and you forget to recover well, then, you're essentially over-exhausting your muscles and their associated tendons, and you can wind up with a tendonitis or a muscle strain. And in those scenarios, if you come into my office and there's nothing really exciting or like jumping off the charts at me about like, oh my gosh, this joint is really swollen, there's a ton of bruising, the x-rays look abnormal, there's something really concerning, then we're going to treat it very conservatively in general. We're going to say, hey, you know what? You need to ice, you need to rest. You could splint that area wherever it is, like your ankle or your knee, with really an off-the-shelf brace. They work pretty well. There's a million of them online that you can choose from. And, and we're going to say, hey, give it some time because, in general, thankfully, your body knows how to heal itself. But it's going to take a good 6 to 12 weeks for these things to really kind of quiet down. And so I think what happens and why we see a lot of people in the office is because they wanted it to be gone, 2 weeks ago, and it's been going on for, 10 days. And the problem is that, your body doesn't work that way, is you got to give it a chance to heal.
Real quickly, I think I've heard that 6 to 12 weeks before. That's kind of in general for soft tissue sort of overuse, or that's
it is
pretty typical time.
Yeah, and it doesn't mean you're going to have pain that whole time. It really is more of on a molecular level. And so, I always tell people, like, as you're feeling better, well, then increase your activity and see if you can tolerate it. And if you can't, well, okay, your body's telling you it just needs a little bit longer. So, it's sort of a ballpark. It's not something I'd hang my hat on, but I think it certainly can be helpful for people to think like, all right, this is probably a 6-week injury.
So we're talking in these kind of scenarios, you're essentially talking about an overuse injury, right?
Yeah, exactly. So like an overuse injury is something that occurs when you've done more than what your muscles were ready to handle, right? So if you are a runner and you normally run 5 miles 3 days a week, and then you decide, you know what, I'm going to train for a marathon. And so you start really ramping up your running, then if you're not building in the recovery time also and some of the strength training also, then you're going to wind up with muscles that fatigue and then can't handle the load of what you're doing and ultimately give you symptoms, right? So either a tendonitis, which is how muscles attach to bones, or a muscle strain.
Well, when you talk about recovery, so what does that mean exactly? If you're training for something or you're out there 3 or 4 times a week running, what does recovery mean exactly?
Yeah, so I mean, I think, in general, athletes are pretty good about, remembering to take a day off or, eat well following their activity. Sometimes, athletes need they need to understand how to eat for their activity. And especially when you increase activity, your nutritional requirements change during the activity and following the activity. If you're somebody who's just not a good sleeper and you're trying to train more, that can be a problem. You can really experience significant symptoms. And then, I mean, we see patients along that whole spectrum of like maybe just some mild overuse symptoms all the way to something called overtraining syndrome, which is, a whole slew of symptoms that are because your body just did not recover adequately, whether it was from, trying to train through an illness or dehydration or poor nutrition or, whatever it was that you wound up with this whole, gamut of symptoms.
Okay, so nutrition and rest are really important. And it's interesting, you're talking about sleep. I think most people, when they're thinking about athletics and rest, they're thinking about, well, it's my day off.
Right.
But you're talking about that. I mean, that's part of it, obviously, but you're talking about actual sleep.
Absolutely. And I think, where we sometimes see, where we do see most of the overuse issues at this point are in our younger athletes. We see teenagers in particular, the young teens to the, high schoolers who are often playing on multiple leagues for the same sport. And so, maybe they're playing basketball for school, but they're also playing on a travel league, and then they're playing, with another travel league. And what happens is that these kids, they've got practice 6 days a week, sometimes 7, they've got tournaments on the weekend. So all of a sudden there's no rest. There's no recovery. And so they wind up in our office because, they've got, a muscle injury, a tendon injury, sometimes a stress fracture of a bone, and it has everything to do with taking that time off, hydrating adequately, eating the right foods for recovery, and sleeping.
And people can find out, I'm guessing you can go online and kind of search for, proper nutrition depending on what your activity is, correct?
Absolutely.
Fairly easy to find that stuff.
Yeah.
Is there any source you recommend for that, or?
I'm a member of the American Medical Society of Sports Medicine, so the AMSSM, and I think that, their position statements and guideline statements about nutrition, not only for recovery, but also for during activity, are really excellent. So I would check out their website.
Okay, and that's the AMSSM, which stands for, one more time, what that stands for?
Yeah, the American Medical Society of Sports Medicine.
Perfect. And so people can kind of look and see what their guidelines are. It's interesting too, because we're talking about adequate recovery time contributing to injuries, essentially. It's a fine line, I'm guessing, because between overtraining, like you say, and the fact that one of the ways to prevent injuries, I know you've talked about before, is training for whatever your sport is, whether it's skiing or it's running, whatever it is, right? So it is a fine line, right?
It is. I mean, I tend to tell people, there's a difference between soreness and pain, right? And that as somebody who's active, you need to learn that difference. If you do, 100 biceps curls in the gym and the next day your biceps are sore, well, obviously, right? You did something to strain or to, inflame that muscle group. And so now you're feeling it. It doesn't mean that you didn't have adequate recovery. It just means that your muscles are responding in a way that they were used, right? Now, if you have pain or you develop swelling or bruising around the bicep muscle, then, that may be injury, at which point then I think, understanding the difference between soreness and injury is really important. I tend to tell people that, I use a 24-hour sort of rule of thumb. Like if you do an activity and you're sore for 24 hours following, that's okay. But if beyond 24 hours, things are getting worse, well, then, okay, maybe you did too much. Maybe you need a little bit longer recovery. Maybe you need to change your workouts to modify to not get to that point again.
What we've been talking about are essentially sort of overuse injuries. Let's talk about a little bit about, a more significant injury. Say you actually torn something or whatnot. What's the most common thing you see? I'm guessing like an ACL injury or something like that.
It varies per season, honestly. So right now I'm in Reno and it's ski season. So I see an awful lot of knee injuries right now. And believe it or not, wrists from the snowboarders and some shoulders as well from the snowboarders. But that being said, I think, probably one of the most common injuries just in the general public is an ankle sprain. And, because darn it, the world is not even. We step off things all the time. And so I tell people, you throw in just being distracted, whatever it is, by your cell phone, by traffic, by somebody calling your name, or you change something like your vision isn't as good as it used to be, or you're in an unfamiliar place and the pavement's uneven. It's just one of the most common injuries we see. And I think, thankfully in general, most of the general public is pretty comfortable with like, oh, shoot, that really stinking hurt. And so I'm going to go home if I can put weight on it and rest and ice and elevate and compress and see how things shake out over the next couple of days to weeks, and maybe follow up with us in the office just for a quick set of x-rays, make sure nothing else more serious is going on. But I think that's probably one of the most common injuries we see.
So if somebody has a more severe injury than an overuse, then it's a bad ankle sprain or something else is going on, what should they expect? What's the process like? I'm guessing they'd be evaluated, there would be some tests, and then physical therapy. Is that generally speaking how it works?
Yeah, it's a great question. So, we do use physical therapy a lot. I think typically if somebody has an injury that, let's say, even if it was, a severe ankle sprain that they really felt like they couldn't stand up on following the injury, I think it's worth coming in, getting a quick set of x-rays. There's a lot to be said for peace of mind, for sure. Mm-hmm. And so, I think in general in our office, what you would expect is that you're going to get a set of x-rays. Somebody is going to look at you, talk to you, see how your motion is in that particular joint. Talk to you about what medicines you could use if you need something for pain. Typically, those are the over-the-counter, anti-inflammatories, things like ibuprofen or naproxen, which are the generics out there, or Tylenol even for just pain, And then really what we're going to do is we're going to follow up with you. So things we expect to get better, just like we were talking about before, somewhere between 6 and 12 weeks. And, nowadays, a lot of sports injuries, we've come full circle where we used to tell people just rest, stay off it, stay in bed for your backache, or your back strain or whatever, or for ankles, like stay on crutches, stay in an ankle boot, a lacer, an air cast, whatever. And now we kind of have come 180 degrees the other direction and think, you know what, let's start moving. Let's get the strength back. Let's get the function of that joint back so that we can better assess down the road whether there really is some lingering problem, whether it's, the ankle joint is persistently unstable or it's just giving you ongoing swelling and pain. So I think we tend to say, give it an initial cool off period of about, 2 to 3 weeks. So that's again the rest, ice, compress, elevate. And then if things aren't getting better, then yeah, we'd like to see you because we want that set of x-rays and because we want to follow you probably with some physical therapy to let, the motion of that joint improve, the strength and the stability around that joint to improve and kind of encourage the right muscles to wake back up and do what they're supposed to do.
Okay, so let's say I came in to see you and I've got an injury that you would treat the way you've just described. When could let's say I'm a skier. When could I expect to get back on the slopes?
Yeah, it's such a good question. So there are a number of programs out there that have been designed to address exactly that question because we know from the research that let's say you're a skier, like you said, Rob, and you have a knee injury and it's just a knee sprain, but maybe initially it swells a little bit, it really hurts, your pain kind of localizes. Maybe, you may or may not even need to take any medication. But, your question of, well, now what, right? If your swelling has improved, if your motion is better, if you feel like you can walk comfortably without a limp, like, is it safe to go put your skis back on and go ski? And so I think, what the research has shown is that, you do have higher risk of repeat injury following an initial injury within a fairly short period of time, somewhere between about 8 and 12 weeks. And so what we've designed in our office and what many orthopedic offices and physical therapy offices will do now is they'll actually use an assessment tool of some kind to figure out just how much risk you have based on that knee injury. And so we'll run you through, a whole bunch of different tests to be able to assess, well, okay, are your muscles around your knee firing the way they should be to control that knee joint in the situation that they were to need to, right? Mm-hmm. And, those types of tests usually only take, half hour to an hour to do, but they can be really helpful to make a decision about returning to play or returning to, activity with hopefully low risk. So, I encourage everybody, if you had an injury that took even a few weeks to get better and you're just sort of tentative, about putting your skis back on, getting back out there to play volleyball, going bowling, whatever your sport or activity is, I think it's worth touching base with a physical therapist, an athletic trainer, a physician, somebody who can truly assess where your risk lies, if it's your low risk or if you still carry quite a bit of risk, at which point we would recommend, strengthening and giving it a bit more time.
Okay. So what are some of the tips then? What are some of the things you tell people that could help them speed up their recovery from an injury? Whether it's basically an overuse injury or a more serious injury, what are things people can actively do, aside from doing everything their doctor tells them, of course?
Sure.
What are things people can actively do to speed up recovery?
Sure. So, I think, recovery is going to take time. And so the best ways that you can speed up or promote good recovery are, nutritional and not getting re-injured, right? So I think where sometimes our younger population blow it is that they feel really good really fast. And so they say, all right, well, I'm great, I'm going to go back. And then they wind up with another injury, which just sets them back again, right? So I think, just, again, taking the time, letting your body recover is really important, and not putting yourself at risk for another injury before you're better from the first one. The other part of that equation, of course, is nutritional. And just like recovery from a hard workout, recovery from, an injury or from surgery or from some very stressful situation like a hospitalization or illness, is really important. And, you can read specifics of, protein intake, and in addition to protein use for recovery does seem to speed up or improve recovery. It also has been shown to minimize muscle loss. So a lot of times with injury, we're resting people. We're telling them you can't go back to your activity. You have to rest and give your body time to recover. Well, if all you do after, let's say you're a multi-sport athlete and normally you're exercising 5 to 6 days a week, and all of a sudden you're, on crutches and sitting on the couch with your, knee up, well, yeah, you're going to lose some muscle tone in a, at a fairly fast pace. And so where I typically will recommend use of creatine is in that phase where you have to rest to try to minimize the muscle loss that happens with rest. So that's where I would recommend use of creatine.
Okay, that makes sense. So the basic things, sort of tips for if you suffered an injury, give it time, really important, rest it. And then follow it, especially in the beginning, I think it's called a RICE, right? Which stands for again?
You're right. Yeah. So RICE, RICE, rest, ice, compress, and elevate.
And then that would be the first thing. Second thing is nutrition. Make sure you're giving your body what it needs to recover. And then the third thing is possibly think about creatine, especially if you're in a situation where you're not going to be using a part of your body because it's in a sling or it's being rested or whatever.
Exactly.
Okay, great. One last thing I want to talk about is, and you talked some about younger people and injuries, sort of people who are actively out there being athletic. They're playing basketball for their school or their club. People in middle age and older, what are some things specifically for that population that people should think about if they've suffered an injury?
Yeah, so I think in a middle-aged and older population, like we sort of led off with on this podcast, the joints are not as good, darn it, as they were when you were younger. And so most people in their, 30s, 40s, 50s have some early osteoarthritis, which is by definition an early loss of the cartilage that covers the surface of the bones at the joints. And certainly once you're into your 70s, 80s, and 90s, we expect that degenerative cartilage loss has continued. Mm-hmm. And so a lot of times with our older athletes who get injured, not only do they sustain an injury to a muscle and or a tendon group, but they sometimes will flare up that joint itself, right? So if the joint has a little arthritis and the joint gets inflamed, well, sometimes the joint requires quieting it down. And so, it's still the same treatments. We still recommend, RICE, like we talked about. We still recommend oral anti-inflammatories. So ibuprofen, naproxen, whatever works for you. And sometimes, when it's prolonged, we'll suggest trying even in the office a steroid injection or something to just kind of get that joint to just knock it off so that the muscles and tendons can start to work the way they're supposed to.
Okay, so just kind of quiet down the situation. So essentially, if you're in an older age group, when you've suffered an injury because of already degenerative conditions that are normal as you get older, arthritis in a joint, that you want to particularly take it easy and perhaps with steroid injections or whatever it is, make sure that joint in general is calmed it down, correct?
Yeah. Okay. Exactly. I think too, just thinking about this, again, older population, this is the population that is losing muscle at a more rapid rate, regardless of activity and exercise. And so this is the population who I absolutely encourage, because they need to rest and give their joint a, chance to quiet down, and muscles and tendons and everything else. That they take that low dose creatine, because it's critical to try to minimize the muscle loss that they experience when they're not active.
Right. And sort of as an aside, maybe a little bit off topic, but explain real quickly to people how for instance, if you have a knee problem or if you've got a degenerative arthritis or something, explain to people, because I don't think people understand that muscle strength is really important to the joint and the joint's functioning, right?
Yeah, it is. It's always a funny discussion that I have with my patients because they kind of look at me crazy when I say, hey, your joint is irritated. I think we need to quiet it down. And I want you to go to physical therapy to get strong around your joint. And they sort of look at me like I'm nuts because they think, like, what? Like she wants me to move this joint and it's going to hurt more,
Right.
And I think, it's not true. I think that the bottom line is that the thing that supports our joints is our muscle. And in the medical world, we call that lean body mass. Your lean body mass is critical for how well your joints function. And so if you don't have muscle tone, your ability to unload a joint is less than if you have really good muscle tone. And so I think what people really experience is that when they have improved strength or muscle tone around a joint, the pain in that joint diminishes. And so, and it's similar to like using a brace that unloads a joint, is that, that's an external way to unload a joint. Muscle is an internal way to unload a joint, and it should and does decrease, pain associated with that joint when your muscles are stronger.
Okay, and if I'm following you correctly, by unload a joint, you're basically talking about taking stress off of it, either with a brace was an example you were using,
Exactly.
or because the muscles there are stronger, they're literally taking pressure off of the cartilage, correct?
Exactly.
Okay,
Exactly.
great. Interesting. Okay, well, thank you very much, Dr. Albertson. That's all for today. Next time, we're going to talk about osteoporosis, what it is, what it does, and warning signs everyone should know about that your doctor might miss. And it's interesting, people think about osteoporosis and they often think, well, that's something that happens to middle-aged women, but it actually happens to men as well. So we're going to talk with Dr. Albertson about that next time. Until then, don't forget you can subscribe to the podcast. And you can also find Dr. Albertson's videos by visiting boneandmuscle.com and clicking on the videos tab. Thanks, and we'll talk to you again soon.